Hi, everyone. I'd like to do a shout out to our sponsor, Baco Diagnostics. Early detection is the single most important factor in improving patient outcomes. The Baco Diagnostics team recognizes how impactful a podiatric physician can be and remains committed to supporting you in your role as the first line of defense in diagnosing conditions of the lower extremity. Thanks to the unwavering support of their clients, Baco Diagnostics has been able to give back to the podiatric community for 16 years by providing podiatric educational resources and advocating for the position. Baco Diagnostics, helping podiatric physicians keep America on its feet. If you have not yet had the opportunity to utilize Baco Diagnostics services, get started today by sending an email to corporaterelations@bacodiagnostics.com. The first 50 podiatry offices who request a starter kit will receive a Dean's Chat mug. Hello, everyone. Welcome back to Dean's Chat, where we discuss all things podiatric medicine. My name is Dr. Jeffrey Jensen. I'm the Dean at the Arizona College of Podiatric Medicine and the co-host for the Dean's Chat podcast. Once again, I'm joined by my co-host, Dr. Joanna Richey. Hi, Joe.
Hey, Jeff. How you doing?
I'm doing fabulous. I became a grandfather for the 5th time Saturday morning.
Yes.
Oh, wow, that's awesome. Congrats.
Thank you.
An absolutely beautiful baby. So congratulations.
No, thank you. And you forget how little those munchkins are. They grow so fast. So anyways, that's what I've been up to. How are you doing, Joe?
Doing good. I think that probably helped nurse the loss of the Green Bay Packers, perhaps over the weekend. I didn't want to rub any salt into the wound, but of the few games I got to catch over the weekend, I did watch that one just for you, Jeff. So
you got to hand it to the Bears. They delivered the second half, and
they really did. They really did. Yeah, and I think there's a ton of very excited fans in that regard.
Oh, for sure. Well, our guest today played some football.
Indeed, I'm so excited.
Team. This time I'd like to introduce Dr. Shane Hollawell. Dr. Hollawell, thank you for joining us on Dean's Chat. Appreciate you taking the time.
My pleasure. Thanks, Joe. Thanks, Jeff, for having me.
Is it all right if we go first names? We're kind of informal on Dean's Chat. Let's go, if it's okay with you, Shane, Joe, and Jeff.
Yeah, perfect.
Well, Shane, thank you so much for coming to share your time and your expertise with us and the audience. From the minute I met you and we had the basic course in Baltimore, your energy and enthusiasm is fantastic. And so I really appreciate you taking the time. We will go through a little bit of a formal intro, and then I'd like to kind of talk about all the different things that you've been involved with as we go throughout the interview. But we'll start with, you completed your Bachelor's of Science in Biology at Moravian College. Then you went on to get your doctorate of podiatric medicine from Temple University. You completed your surgical residency training with the Graduate Hospital Curative Wound Care Center in Philadelphia, Pennsylvania. And you're currently the fellowship director for the Orthopedic Institute at Brielle Orthopedics in New Jersey. And we'll get to that as we go about the interview. But I'd love to start with, you have a wonderful athletic career. And I'd love to start with, how did you find out about podiatry?
I was actually through college, and my academic advisor, who was a big football fan, in the biology department. And, we had met a few times and we discussed career paths and my interest in medicine. And, he had known that I was very involved with football, and I was considering, my career beyond college for football. And there's some injuries that led to some decision making, some surgery that led to some decision making, for myself. So it came down to where do I and when do I make a decision? And I really took his advice. He offered, some opportunities for podiatric physicians for me to shadow near the college, and I did. And then I shadowed again in Philadelphia, where I'm from. And, that just kind of led to the next decision to go into podiatric medicine. I still was debating I didn't have NFL aspirations. That just wasn't in the cards for me, but I did have, further professional football aspirations. And it was, I had to sit out another year to go into a different path in medicine potentially, or I was going to play football, or I was going to podiatric medicine route. And, here we are. I couldn't be happier that I made the decision I made.
Yeah, and there's so much sports medicine that's a part of foot and ankle care. But Jeff, what are your thoughts?
So with Philadelphia roots, were you feeling it yesterday when the Niners beat the Eagles?
I was there. It was
You were at the
terrible.
game.
I
Oh
was
my
at the
God.
game. Yeah, I'm a long
Oh,
time
fantastic.
diehard Eagles fan. I was at the game.
Are you? Yeah, I was watching it on TV and I thought the Eagles left a lot of opportunity on the table.
Yeah, like they've done all season. I've been to 3 games this year, and we're 0 for 3 at the game.
Oh, good Lord.
Yeah.
Oh, I'm sorry. I'm sorry about that. But I'd like to keep talking about football.
Sure.
Shane, one of the neatest things we do here at the school is interview students, right? We're always interviewing them to come into the college and enter podiatric medicine. And we found a trend, a lot of athletes, they're already well-versed in time management and they're very goal-oriented. And then if you take a collegiate athlete and you combine it with some good grades in the sciences and an MCAT score, they make phenomenal students and future docs. How did football play an influence on you and kind of forming your career and career choices?
No, to your statement, I couldn't agree more. With the time management, their goals, dealing with adversity, whether it's injury or whether it's making a bad play and then needing to, rebound from that. So they know how to deal with adversity, and we know in our profession, especially as a surgeon, you're dealing with adverse outcomes, periodically. So I do think there's a huge crossover in terms of an athlete and being a physician. And football has been a part of my life since I've been 6 years old. I've come from a family of football players, and it's been ingrained in me at a very young age. So it was basically a second part of my life for a long time. And regarding goals, getting up in the morning, doing workouts, making sure that my schedule was staying in the on task, so to speak. So I think that with time management is critical, because when you first go into podiatry school, you got to manage your time very quickly and very efficiently. And it's a big change from college and just in the volume and the curriculum that's put in front of you. So without a doubt, my athletic career has helped me make that adjustment very, very quickly once school started.
Yeah, and dealing with challenges in the face of adversity, as you said, or just that quality of perseverance and grit. It just seems like when collegiate athletes are trying to navigate academics and a sporting environment, it's a good mix.
Yeah, it's definitely healthy for the mind, right? You have someone who has a sports background. It's really, tells you that they've endured and made a commitment to things.
It's all it takes sometimes. And a little bit of passion and hard work, right?
Yeah, sure.
Discipline. Yeah.
Yeah, absolutely. Well, that's fabulous, Joe. That was my initial thought. You can take over from there for a bit.
Yeah, I'd love to know, Shane, if you had a young athlete that was talking to you about interests in healthcare. They didn't know what they wanted to do, but they were on the fence about where should I go from here? They were a very active athlete like yourself. What advice would you give them in terms of how to figure out what the next chapters of their life might look like?
Yeah, I think it's a great question. So, I think all three of us agree that the field of podiatric medicine and surgery is a wonderful place to be and have a career in. And I think for the person who's undecided, just doesn't maybe have enough exposure, it would be exposure, then more exposure, and then figure out what your interests are in medicine. They may think they have an interest in certain things. They may have a preconceived notion about certain things, which we get that sometimes. And they have to understand, as much as can be understood with shadowing and seeing, the realities of what we do in the field of podiatric medicine. So I think it really boils down to being open-minded and willing to give yourself exposure to the things you're considering in medicine.
Yeah, I agree. It's amazing. You can only do so much internet searching, but to see it in real life, and you had reflected on that your college advisor had helped you kind of find some connections. And so certainly in the now the digital world, it is a little easier to do your own little internet search in terms of people around you. And, there are lots of different mentor opportunities through the college and other places where you can find a podiatrist. So I appreciate your thoughts, because there is a unique experience of being an athlete, having your own foot and ankle injuries and having a little bit of an interest there. And to Jeff's point, maybe a little passion that's there, but then you have all these skill sets that help already set you up for success differently, perhaps, than someone that comes in with other skills and attributes. So it's always nice to hear from people that have that lived experience. I'm curious, what position did you play as a football?
I played safety.
Okay.
Defensive back.
Yeah. Oh man, there's so much strategy in sports psychology I'd love to pick your brain on, but maybe we'll save that, because go ahead.
In particular, you have to really, the cerebral aspects of football without a doubt, defensive game and how they battle the offense based on strategy for sure.
Yeah. I'm curious your thoughts on those specific attributes of the psychology behind what you do as an athlete and the psychology behind what you do as a surgeon. What's your take on that?
Yeah, again, another significant crossover, because you can't just show up for surgery and expect that. I mean, probably can if you're doing the same surgery for a long time and many years over and over, but we're always faced with challenges. So you have to study, you have to, watch game film. You have to really understand, what you're dealing with and the nuances in order to get, a better outcome. Whether it's on the football field or whether it's in the OR, you have to, go the extra yard to, give your patient the best outcome or give your team the best opportunity to be successful. So it's not just showing up and practice, and you have to do studying, you have to read on your own, you have to look at game film on your own. So without a doubt, there's further crossover.
Yeah. Oh, that's incredible. Jeff, your thoughts?
I've got an analogy for you, Shane. I was thinking about the Packer game against the Bears, and it was like a tale of two halves, right?
Yep.
And it's amazing to me that the halftime adjustments can make that much of a change. But it's not unlike a surgery that's going well, and then all of a sudden there's a little bit of a complication. You got to shift gears. What do you make of adjustments during surgery, like plan A, plan B, plan C, or how do you approach that? And is it a good analogy with football? It might not be.
No, I think it's a great analogy. I mean, we're always, hoping for the simplest and boring surgery, because that means it's just going, routinely and as expected, which usually translates to a better, outcome or simpler recovery. But inevitably, there's always things that happen. You bone's softer than you thought, or you push through with the screw, or a stress riser occurred, or the hardware, just wasn't purchasing. So, you always have to be adjusting on the go. And like you mentioned, halftime adjustments are huge. I mean, the coaches that are most successful are the ones that have the best halftime adjustments. And so, the best surgeons are the ones that make the adjustments intraoperatively, keeping your cool and just knowing that, you have everything in place available to you to adjust for the outcome. That's having multiple, sizes or screws or valve or something along those lines. So, you can go back for, as long as you want to go back to and look at coaches that are good at halftime adjusters, and their success translates. And, surgeons that are willing to adjust quickly and not get emotional, their results translate to the patient outcome.
Oh, I love that. Can I do a follow-up here, Joe? So Shane, as a student, they're all interviewing literally as we speak for residency programs around the country. And then students go to a 3-year surgical training program. They may or may not do a fellowship, but that course of learning and that course of understanding doesn't happen overnight. It doesn't happen in 3 years. What have you seen with your colleagues? I mean, being part of FACFAS, and there's a lifelong learning and element to all of this.
Mm-hmm. Well, they call it practice in medicine for a reason, right? So you're always practicing, and the things evolve, technology changes. You got to keep expanding your skill set. The more you expand your skill set, the more you can, help your patients with, right? So if you think you're dealing with something routine, but you have an expanded skill set because you dealt with infections in the past, then you can help them manage post-op complication a little bit more effectively. So we're always making adjustments. In the field of play, whether that's basketball, football, soccer, and you got to forget about the last play. So they come back to your office after surgery, and surgery was supposed to, you thought the surgery went perfectly, and then they come in and they have wound dehiscence. So you have to adjust, and you have to be very judicious about managing that, and that's forgetting about how well your surgery is. You got to deal with them being right in front of you, and you have to think about the next step. So I think it continues to translate that we're always practicing, whether it's our practicing for our sport or practicing in medicine. It never stops.
Absolutely. Well said. Very well said.
I think that's a beautiful segue too, Jeff, into you're currently the fellowship director, Dr. Hollawell, at the Orthopedic Institute, Burriell Orthopedics in New Jersey. You're also a faculty member at the Hackensack Meridian Jersey Shore University residency program in Neptune, New Jersey. And you've been faculty at Rutgers Medical School. So you've done a lot of education at multiple levels of trainees. What have you seen as some of the biggest changes in medical education and specifically resident and fellowship training?
Well, I think the fellowship training has expanded in our field, right? It's always been a staple in the orthopedic world. And I think that the way things are evolving, that extra year is critical for a few reasons, because you just get a different slant on things in the fellowship world compared to residency world. Residency, you're obviously mostly hospital-based. You can do some outpatient surgeries. You can do some outpatient clinics, but you're doing those, not as routinely as a fellowship would have you do as a office-based setting, learning how to bill, learning how to manage your time, learning how to manage your complications after surgery, because residents don't necessarily see the patient back in the clinic. They're just not available based on scheduling, or the timing just doesn't work out. So, they get to see the patients, post-op visit 1, post-op visit 3. So, things happen in different stages. So, I used to have the philosophy that fellowship, when I first started, was, going to be beneficial. And for the reasons that I mentioned, but now I think it's really probably should be something every resident should consider, because it's just going to make you a more well-rounded physician over 30, 40 years of your career. You're talking about one additional year. And I think if you look at the statistics, the fellows come out and they have a better offer. And we're in the process of collecting that information. We have some preliminary results that indicate that. When I say a better offer, initial job offer, whether it be salary, whether it be compensation in some facet. And I think that they can hit the ground running, because now they've been in an office setting. They know how to manage their time. As we know, we have patients that like to talk, and that's why they're there, to talk to us. But you have to kind of reel that in order for your day not to get hijacked. So I think they learned that, and that is one of the things, besides doing a little bit more hands-on surgically, how to get to manage your own patients surgically with some supervision, and that depending on how the fellowship's set up. But I think that we as a college are going in the right direction, really supporting these fellowships. And we're getting a few more added each year over the past several. So hopefully that trend continues.
Yeah, I agree. I think the future of surgical training specifically is really in the fellowship world. But Jeff, what are your thoughts? I know you love this topic as well.
I do. And Shane, I'm curious. We've asked other fellowship directors the same question. The benefits that a fellow would have by being with you for 1 year. What do you think about the concept that that's kind of vaulting their clinical career forward, maybe an X period of time? What are your thoughts on that?
Yeah, I do. I think the numbers bear out, as I mentioned, having that initial offer being a little bit of a better number in either starting salary or the incentive-based packages. There's been some feedback from my fellows directly that a few of the potential employers, are looking for fellowship trained podiatric physicians. So the 1 year extra, which sometimes seems like a lot after you did college for 4 years, you did podiatry school for 4 years, you did residency for 3 years, it may seem like a lot on the tail end of that. But, what we know, we've been in our career for some time, is that 1 year is really meaningless. in the big scheme of things. So if they're open-minded to, being a lifelong learning, then that extra year, I think, could be very meaningful to the right, person seeking fellowship.
I agree. I was thinking kind of also in terms of, we had a couple fellows on the program also that said it kind of vaulted their clinical decision making and their surgical skills perhaps 3 to 5 years. And that's very anecdotal, Shane. I mean, that's not scientific. Do you see the same?
I do. I think, maybe not just the hands-on aspect of it, when you're moving your hands and doing things surgically. I think you get a lot of that. You're probably, getting a lot of volume, probably the most volume you've ever gotten in your third year residency. But, we know when you start thinking critically, then your hands kind of do things that don't necessarily correlate to critical thinking at the same time. So I think as a fellow, you get a little bit of that, okay, things aren't going so well. I still have to think my way through this. Well, I still have to execute, the technical aspects of the surgery, where you still have that little bit of supervision by the fellowship director. So yeah, I do think it vaults the career forward for sure. And the other thing is probably it's not talked about as much, and it depends on how the fellowship is set up, is, learning how to manage, your office through billing and through, the clerical aspects that most podiatric physicians go into private practice. There's a trend that shifts a little bit to academic and what have you, but still the vast majority of our clinical positions are private practice. So I think it really vaults the career forward in the private practice, aspect of managing, the business side of things.
Couldn't agree more.
Yeah. And, it's interesting too, when the FACFAS has recently released their compensation study, and I appreciate, and same with APMA, neither one of them talk about it's just salary, it's total compensation. And so I'm also curious your take on, fellowships also help you network. They give you a whole different reach in terms of other opportunities that are out there. And so while certainly one more year of training that obviously is not at what you would make from a quote unquote salary perspective, but what that could translate to and how that then catapults the next section of your career, I think again, we don't have these numbers directly, but I think it more than makes up for whatever potential losses would have occurred over the last 12 months. But I'm curious what your take is on the opportunities that fellowship helps set these graduates up for.
Yeah, again, another great question. I think if you look at, how the fellowship scenario plays out, is there's 65 fellowships roughly that are ACFS recognized, and that number continues to grow. Maybe once in a while we'll have a program that retracts itself from ACFS recognition, but all in all, it's growing year after year, and a lot of it is, residency directors referring a resident to me directly. And then a lot of it's, someone's looking for a job. Hey, do you have a fellow that you're really high on? And then that network is, we're a small profession, even though we're, 10,000 strong in surgeons, generally speaking, but we're a small profession overall. And so, you talk about your good residents, you talk about your good fellows, and, they're the ones that, get put in a good position to succeed and be offered an opportunity. And and then when you, again, look at the starting salary, I think that information is going to be very clear as it relates to not just the starting salary, but as you mentioned, the compensation. What is your incentive package once you collect X amount, or what is your 401k and things like that? There's tend to be very or better package offers than just coming out as a resident. I mean, my residents ask me to review their contracts. I try not to get into too much detail with them, and then the fellows ask me to review their contracts, and then, I just see the difference in the offers.
Yeah. I'm curious what your take is on advice for residents looking to apply for fellowship. When do they start that process? How do they stand out at something like the ACFAS breakfast? Or now I think they actually do like an after-hour mixer as well. There's a couple different opportunities for them to engage. This
will be the first year it's not the breakfast.
Okay, yeah.
it's hard to really stand out in a big room with, you're going table to table. You just try to get some information as the resident, as much as you can, get a quick face-to-face. Time is limited, so you're just trying to show a face, showing you're interested, and then you do the follow-up with the application. You get your letter of recommendations, and you make sure that everything's done at once, and make sure that the timeline that you have in mind is kept. You're looking as the fellowship director who's going to potentially interview them, that makes sure that they are staying on task to the things that are required. So that's pretty simple, straightforward. And then, you got to, as the director, do your own research and talk to the directors from the residency or the attendings that have worked with the resident. So from my perspective, I do that pretty consistently. From the fellows' perspective, I think they have to look at what they're looking for in fellowship. Are they looking for more Charcot training versus more sports medicine training or reconstructive training? Because that is important, because a lot of the fellowships vary to, specifics. They specialize in different things: diabetic, Charcot care versus, reconstructive or joint replacement, things like that. So I think the fellow has to do their research. Their directors are usually pretty good, at least the ones that I have been referred to, about knowing what the resident is looking for the additional training. The residents also probably understand sometimes there's a little hole in training. You don't do a lot of total ankles in some residencies. Some do a lot of total ankles. Some don't do a lot of Charcot, and they want to get that extra year of Charcot. So that's something that they have to figure out what interests them in the long run. And then the other thing is, I've hired 3 of my fellows. So, I will be hiring 3 of my fellows. So again, we're looking to make sure that they have the skill set, they're adjusting, and they have the demeanor. And, it's worked out wonderfully for my practice.
Yeah, thank you so much. Sorry, one more question, Jeff, and then the floor will be yours. Resources. If residents are looking to get more information about different programs, where would you send them to get that kind of information?
Well, the ACFAS website for fellowship is a pretty good resource. Where the programs have to list what their focus is. Whether it's research, whether it's Charcot, whether it's office space versus hospital base, whether it's private practice supported fellowship, or whether it's an academic fellowship. So that information is very readily available on the ACFS website. And then they have to do their own research beyond that. Just look at the practice, Google the practice, or Google the doctor that is the director, and you can get a pretty good idea after that.
Excellent. Thank you. Jeff, the floor is yours.
Shane, I have a question for you. And this is because Joe and I are always talking to students as they're approaching clerkship choices and residency rankings. Is there a trend now that students that know they want to do a fellowship, there's certain residency programs that are preparing them for fellowships? Or is it just a one-off, students interested, so they apply? Or not residents interested, so they apply? Is that
that's a good question. That's a hard one to kind of pinpoint from I've been doing my fellowship, I think, going on year 8 now. So it's hard to say, is the programs, suggesting. I think programs routinely have their residents apply for fellowship. I've seen that. But I do think it's an individual decision. I think that it's really the motivation of the resident would be my take-home point to say, if I could now narrow it down, I think it's probably more the individual motivation.
I think you're right. I know that, like, if our students go to Georgetown with John Steinberg and they do his 3-year residency program, I think a majority of them are going into fellowships. But I don't hear that from all residency programs. So I kind of agree with you. I think it's an individual thing.
Yeah, I've seen a lot of applicants from different programs that are year after year. So yeah, I think the residency directors probably promote it, and then the individual has to determine, if they're wishing to pursue that. But yeah, I think it's a combination of both.
I think so. And if the residency director is not promoting it, the odds are they're not going to be going in that direction. So it's a huge decision. Joe, your thoughts on that?
Yeah, I've started telling students to ask. Like, there are some students that already know in their second or third year, I know I want to get the maximum amount of training that is possibly available to me. So, and I tell them that's a great question to ask when you're on your externships. Ask the residents, how many are going into fellowship? Why are they going into fellowship? Where do they go? Because it just gives them more information about, to your point, Jeff, maybe not necessarily direct pipelines, but networks, right? You start having great experiences with, common group of programs. There may be some commonalities or trends there. Again, that is in no way a guarantee, but it helps people get a gauge. Because if you know you want to do a fellowship and you're asking the residents, or anyone going into fellowship, and the answer is no, that doesn't mean you can't do it, but maybe you would rather go to a program that you already know you have contacts and points of reference that you can reach out to. Hey, tell me about your fellowship program. What was the value that you felt it gave to you? What were the opportunities that it presented to you? Because again, it just helps you get a little bit more of an experience and an idea behind where you want to devote your time. Because to your point, Shane, this is a very individual thing. And the beauty of fellowship is that it is a little bit more refined and specialized. It's a subspecialization that you really get to refine those skills over that year rather than acquire skills. You're mastering your experience. I mean, of course, you're not a master as essentially a fourth year resident, but you are mastering your experience at that phase of your training. And so it is appropriate to say that it's not expected to be a replacement for the training that you need to be receiving as a resident, but having somebody that has gone through it before to help you answer those questions about what you've identified as areas that you are interested or wanting a little more refinement. Did this particular program provide that? And I think that those are really easy ways to ask as a student level what that residency program has to offer. Again, it's not at all a guarantee, but it just kind of helps get the conversation moving in that direction. So that's kind of my thought.
Yeah, I agree. I think it's a strong point because, the more information you have, the better, more well-informed decision you can make, right? So if they have, a residency program that's never had a fellow matriculate, then, and you absolutely know at that time in your career as the student that you want to pursue that fellowship, you should probably look for a program that has sent residents off to fellowship because you can lean on them. You can ask them questions. Why did you do this? And what led you to this decision? And what did you feel about your fellowship? If you have nobody that you can ask through all the years that went through residency is never matriculated to a fellowship, then you're right. You're not going to get that same perspective. So the more perspective you can get, obviously, the better decision you can make.
Yeah. And
the sooner they know, the better, right? The sooner they have an idea.
Absolutely.
Yeah.
Yeah. Because everything happens so making those, you don't get to wait until the end of your second year to decide. Like, you need to kind of start putting those cards into alignment because, to your point, Shane, from your perspective as a director, you want to know, is this resident doing all the things that they need to do to be able to come and be a part of our fellowship program? And so to start laying those dominoes into their proper alignment, you do kind of have to start thinking about these things earlier and earlier. And one other thing that came to mind is, Jeff, I think you had said, if you have a residency director that isn't supportive of fellowship, doesn't think that it's quote unquote necessary, then I can think of scenarios where residents get talked out of a fellowship when maybe they would have done quite well in something like that. So again, I think it's an easy question for students to ask, even if the student is on the fence, I don't know if I want to do fellowship or not, but being able to gather, to your point, Shane, more and more information is useful when you are individually trying to figure out what you want your path to look like. Gathering those pieces of information can really help you figure out what you want your dominoes to look like, so that once you get them all lined up, then it's just a matter of pushing that first one.
Mm-hmm. Yeah, I mean, lots of times they don't know what they want to do early in their student career, but if they're open-minded, then you can certainly tap a experienced resource, which is someone who just did fellowship. That's probably the best resource you can tap, right? So, it's unfortunate, but we don't know what we want to do all the time when we're that young. But if you have that motivated student, that's probably the best scenario you can ask for. And they're going to set themselves up for success if they follow a pathway where those before them have traveled. So that, the days are long when you're a student and resident, but the years fly by, right? So the sooner you know, the better.
Yeah, absolutely.
Joe, I have a question for Shane before we start talking about all the giving back to our profession. So Shane, when I was looking at your CV, something jumped out at me, and it was like, I'm sure Shane's had some incredible mentors, because you don't see people that involved if they haven't had somebody kind of showing them the way or leading by example. Is that true in your case?
Yeah, my residency experience was phenomenal. I was fortunate to have a 3-year residency back when there wasn't a lot of 3-year residencies. So the foundation that was set in my residency really set me up for, where I am today without question. We had a very good situation in Graduate Hospital in Philadelphia, with the program being very mature, and the attendings having a lot of respect, from the residency director to the chief to the associate attendings, is that we had all aspects of treatment covered, with wound care, ER call, and a lot of hospital based procedures. So I would say it goes all the way back to my residency, which helped me, be where I am today.
That's fabulous.
Any individual people you'd want to shout out or give a mentor high five to?
Yeah, I would say my residency director, Rick J., who's since retired. He was at Graduate Hospital for a lot of years. That hospital now became a rehab center, and now the program got merged with University of Pennsylvania. So he was integral to bringing me into the fold, and he and Dr. Schoenhaus and Dr. Roberts and Chairman, there were probably the 4 main attendings that we did a lot of work with. And they gave you a lot of autonomy. If they respected your decision making, then it led to more decision making, which I think was very, very helpful.
Yeah, thank you. We love mentors. That's a great question, Jeff. And we'll take a quick break to hear from our sponsors. But before that, what about currently? Anyone that you've worked with that has been an inspiration or mentor?
I would say there's a lot of. I've been in my current practice for let's say 22 years, and some of the partners, different perspective orthopedic partners that I've become friends with, and just how they manage their surgeries and their specialties. I've had some partners that have operated on my kids, so I would say that from a general practice standpoint, how they treat certain conditions conservatively or surgically, I've learned from their perspective. I also learn a lot by teaching, right? We talk about that all at once: see one, do one, teach one, and then you really know when you're teaching. So over the years, when I was with Robert Wood Johnson, that was an orthopedic residency that was rotating at my hospital at Jersey Shore before there was podiatry resident, and I had trained the orthopedic residents for years as being their foot and ankle exposure, and I learned a lot from the residents. I taught 3rd, 4th, and 5th year residents in orthopedics. A hospital since dropped that program and went back to just the home base, and then we got the podiatry residency. So I've learned from my fellows, and I've learned from my residents, both orthopedic and podiatric. So I probably learned just as much from them as I've taught them over the years.
Beautiful.
Well, let's hear from our sponsors, and we'll be back in a minute. We all know that early detection is the most important determination in improving patient outcomes. Bako Diagnostics remains committed to supporting you in your role as the first line of defense in diagnosing lower extremity pathologies. Bako Diagnostics, helping podiatric physicians keep America on its feet.
All right, well, we're back. So Shane, I'd love to kind of transition, and you have given back so much to the profession in various different regards of service. and then also giving back to your community. So we'll end on some of the personal and community stuff, but we'll start with the American College of Foot and Ankle Surgeons, as you've been incredibly involved with a lot of different committees. But most recently, you've been part of the board of directors. You've been part of the Education and Scientific Affairs Committee, and also part of the Leadership Development Task Force. And so those, I'd kind of like to start with those, because I really feel like there is so much in the regards of leadership in the profession. And I'd love to get your take on, what does leadership mean?
So, it's a great question. Leadership means, to me, how to be involved, how to, lead people that don't have the same experience level that you have, and lead them in a way that is positive and educational, specific to our profession, educational, and, building confidence, helping them build confidence as they, matriculate through each year of the experience.
Yeah, definitely something I'm sure that resonates with you, Jeff, your confidence, competence equation. What are your thoughts, Jeff?
Well, I agree. I mean, leadership, we've never needed more leadership in our profession. And we have tremendous leadership right now. And if you look at APMA or you look at ACFAS, any of the leading organizations, there's people that are steering the ship in the right direction right now. And to your point, Shane, I mean, leading by example, respect, helping people move to a next step, or perhaps even showing them a path they're not even aware of. You never know where that leadership may go.
Yeah. Very true.
Shane,
And,
when you think about, go ahead.
I mean, you can lead by being out front. You can lead by being very subtle. So there's different ways, and you have to adapt to, who you're leading.
Yeah, I was going to say.
Think about the. Sorry, Jeff.
Sorry, Joe. I was starting to think in my mind. When you're in a practice, you're leading your staff, and then you're in residency training, you're leading students and residents. And then when you're in FACFAS in a leadership role, you're really directing a surgical profession. And then, Joe, like you and I are in a position right now, we're kind of leading colleagues and helping each other be all we can be. So there's so many different levels of leadership depending upon the point in time.
For sure.
Sorry, Joe, I didn't mean to cut you off.
No, you're good. This is what's so fun about these, right? Like I'll have like a question that I know I want to ask, but there's all these really interesting ways to get there. And I like, Shane, that you brought up, there's not one leadership style that everyone needs to be this kind of leader or do something like this. That there are so many ways to lead, and we need everyone in their own leadership capacity to hold their own, to be that excellent version of themselves. So my next question would be, where do you think the future of leadership for our profession goes from here? What do you think that looks like continuing to move forward?
I mean, we're a profession has different aspects to it. So I think collaborative is always important, with the different aspects. It's always good to be united. I do think the future of our being future podiatric physicians is still growing and, in terms of evolving. And I do think, as you and I had spoken in the past, I do think it's really surgically directed. I mean, that's where our parity is really coming from. And I think the pathway is there that maybe historically hasn't been there in the past for, whatever reasons and restrictions that were, previously in place. I think we have evolved, as a profession to offer, good foundation education that you can continue to have, the ability to keep bettering yourself as you may feel like there's something that you're not as strong in. You have the ability to pursue that and make a weakness a strength. And our college and our profession offers that opportunity that maybe it wasn't available 10, 15, 20 years ago. I think it's available now. It's just a matter of, the individual practitioner pursuing it. And I think that is the future is surgically and medical parity within our profession is as I mentioned. So
yeah, no, I love that.
In a lot of ways, and there's still some room for growth.
And the idea that you commented on that just, I think, really sits well with me is this idea that if there is something that you need or want, go find it, because each of us has the opportunity for excellence. And when we hold each other and we uplift each other, but we hold each other accountable in whatever regard you want to demonstrate your excellence, we don't all have to be the same, but we do all have to be excellent. And it's okay to seek out help and guidance in the areas that maybe this is an area that I don't feel as strong, but it's interesting and I want to keep it. So find what you need to get to that point. If it's an area you're not interested in, that's great. Find your referral networks, find the people that you can continue again to support each other, support the profession, so that we as a collective team continue to move forward with excellence and accountability. And I appreciate, and that may not have all been your intention, but that's what I took from what you were saying.
Yeah, excellence is achievable, right? I mean, you make a great point. It's achievable if you desire that you want to be, an expert in this part of our profession. You can find your way to become that expert, in your community for your patients, without a doubt. It doesn't always have to be that you're recognized, by the college right away, but ultimately you get recognition if you continue to have that path of excellence. Your patients know it first and foremost, which is the most important thing, right? So,
Shane, the FACFAS annual meeting is fast approaching. It's going to be in Las Vegas. By the time this episode airs, it'll just be a couple weeks away. What are you looking forward to this year?
I'm always looking forward to seeing people that I don't see other than annually. You learn something new every time you're popping into a lecture and what have you. The collegiality, I think, is probably the number one thing. And, being on the board still, we have some, policies and decision making. So, I look forward to having a cerebral discussion about, what path are we taking next. So, all that.
And I'm looking forward to the same. I'm looking forward to seeing everybody. It's always fun to meet in Vegas. It's always odd to do the meeting early in the week, like we do when we go to Vegas. But I'm looking forward to good lectures. I'm looking forward to, I always tell our students, the exhibit hall at FACFAS is like a podiatry student, resident, clinician, Disney World, right? I mean, you go down there and wow, look at all this. So we have a lot of students going from the Arizona College this year because it's so close. You can just drive over there.
Yeah. You can learn a lot by walking past booths and having a conversation with a rep when you're a resident and say, oh, look, we have this new way to manage this condition. And it just, you're not going to be making the decision, becoming an expert in it, but at least it opens your eyes to it and you can start reading about it. Yeah. So I agree that even the industry hall is very helpful.
Absolutely. What are you looking forward to, Joe?
Oh man, there's actually several things. The track I think I'm most interested in is there's a international sports one that I think, again, I just having the opportunity to have collaboration, international collaboration, which I know FACFAS has really been pushing for over the last probably 3 to 4 years, maybe, Shane. I'm not sure when that really started, but I find those so fascinating. And even though sometimes the same technology isn't always available here in the States, just having the intellectual curiosities, the little things that spark interest that maybe you hadn't thought of before, or perhaps it's like a highlight of what might be coming to the States in some of these cartilage replacement things. But that's probably one of the ones I'm the most excited. And then I really find the MIS tracks right now to be very interesting because it is still an area at this phase of my career where I get a lot of learning out of because it's not my area of expertise and I find it all very interesting. So I think those are my two ones that I'm the most excited about.
Yeah, I think a lot of our surgical training is geographically based, right? So, you get that international feel. That's a whole different, potentially way of looking at things. So yeah, I agree with that.
Joe, do you want to roll into some rapid fire?
I do, but I want we were not going to have time to get to like patents and innovations and all that, Shane. Yeah. But I do. You're very involved with your community, and one particular thing that I just found really inspiring when we are all pressed for time when it comes to things like what we say yes to. you have still prioritized making time for things that are outside of podiatry. One that I will highlight is your involvement with the Marine Corps Scholarship Foundation, where you provide educational funds for deserving children and combat veterans in Monmouth. Did I pronounce it
Monmouth
correctly?
County, yes.
In your county.
It's one of the counties in New Jersey. That's kind of the county. Oh, it's a county I live in. It's a county we have a few offices in.
Yeah. Can you talk about your community involvement and why that stays important to you?
So my involvement is I played golf with over the years with a few ex-Marines, and one of the gentlemen has been running it for years, has since retired. So he's looking for, backfilling the board. So, based on my involvement and supporting it, through raising some funds and what have you, that's how I got into the board role. And, for the past several years, things change and we have new board members, but ultimately the goal is to raise money for needy Marine Corps families that are, pursuing a college education. So, it's a kind of a pure way of being involved and giving back. And, not only are you giving your own time and some of your own money, but you're raising money, which, you can see, the impact it has, because the families come back and give testimonials from years past. And you can see, in those families in New Jersey, what impact it's had to them. So it's a great thing to kind of see, your work come to fruition.
That's beautiful. Jeff.
No, I like that too. You know what? I jumped the gun there. I wanted to know more about the greatest thing that people talk about innovators. Well, the kind of the definition of an innovation is having a U.S. patent and inventive ideas and working as a collaborative team to advance care, whether it's for the patients themselves or for the docs treating the patients. Can you talk about some of your creative endeavors?
Yeah, I've been interested in, a better mousetrap for all the years of doing surgery, right? So some things that you were like, wow, that's a pretty innovative thing. And, you adopt it and you were like, well, that's going to be reproducible. And some things were like, well, there's probably a better way to do it. I haven't, had a great outcome by, encountering that condition. And then, okay, so how can it lead to something, a little different outcome, let's say? So I've always kind of had that interest in a better mousetrap, and also an engineering, interest in, like, okay, so I understand why this plate was this thickness, why the angle of the plate was designed to be this, and things like that. So I'm always thinking, well, you have your plate, it's designed, it's this degree. I always bend it to this degree. So my involvement has kind of been, as a result of that, is there a simpler, better way to get an outcome for a condition that we see, fairly routinely. So that's been my background in development and innovative ideas.
I like that, because experience lends a hand to walk down that path. Because, a lot of people think that when you have an invention, all of a sudden you wake up in the middle of the night and you go, aha, and it doesn't seem to work that way.
I haven't seen it work that way, really. It's just more about over the years, like, what have you been frustrated about, or
yeah,
what way do you think you could just make it slightly better? And that's been, my kind of gateway to getting involved.
That's fabulous. Joe, any last comments before we do rapid fire?
Yeah, now I'm ready to switch.
All right.
And so just to preface a little bit too, Jeff, Shane had to suffer through being assigned with me at a station. So he had to listen to me talk 12 times the same thing over and over again. So he's already, I would
Thank God
like, throw a couple rapid fire in there to like make it fun, try to make it where he didn't have to really suffer too much. But so I've already asked him some of my questions. So I have I
have a feeling that was an informative station.
Oh, we had a lot of fun. Yeah.
Yeah.
That's fabulous. Okay, you go first, Joe.
All right. So Shane, I want to know something that recently, and it doesn't have to be podiatry, but it could be, that you've changed your mind about.
Ooh, changed my mind about. It's a good question. Probably playing golf and how, upset I get about myself and realizing that's not helping my performance.
That's a good one. Yeah. All right.
You gotta go the opposite way. You gotta relax a little bit, be a little bit more calm about it, and then you execute the next shot. It's easy to get frustrated about a wayward shot. So
yeah. Deliberate practice is frustrating, but finding a way to not let it turn that like internal like anger or like I'm not able to do it. Just make it fun. Figure out how to make it fun.
Yeah, golf is certainly like that. The more relaxed you play, probably the better you play. So
Yeah.
kind of like surgery, right?
Yeah.
Absolutely. There's so many analogies. So I have a question for you, and this is not so much rapid fire, but let's say you're in a game and you step in and you're about to pick off a pass that would give you like an interception with a touchdown, pick six, but you drop the ball. How do you shake it off? That's kind of like the golf question, right?
Yeah, I mean, it's that plays behind you. You have to shake it off, right? You have to move on to the next play. I mean, that's
Yep.
Kirk Cignetti's philosophy has been, repetitive and consistent for years. And he talks about it's a 6-second play, and the play is behind you, and you have to play the next play for 6 seconds, and then you have to play the next play after that for 6 seconds, and then it's just the accumulation of those 6 seconds. What is your outcome? And if you approach it like that the last play didn't matter, and you're going to have a lot more success, because then you just you're in the present, and then you prepare for the next play.
I think that's so great. I think one of the best interviews I've ever seen was Kirk Cignetti last year, when he was just kind of coming on the scene, and you had a bunch of reporters asking him questions, and he said, "I'm a winner. Google me." I thought that was so awesome.
That's great.
All right.
And he's 100% accurate on that one.
Oh my gosh, he's amazing. I know.
Yeah.
I've been rooting for them. My son went to Ohio State, so I'm kind of, now that Ohio State's out, I'm all on the Indiana bandwagon.
Yeah.
All right, I got one for you. You and your family are going on a non-podiatry vacation. Where are you going?
Oh, it's great. Well, we've been to Sweden, or I'm sorry, Switzerland, and we loved it. So it was probably the most beautiful place I've been. In the future, I mean, we do have a board meeting in Hawaii that we'll be at, so maybe I'll piggyback some vacation with the Hawaii trip. Probably the other place would be, I don't know, I like active vacations. So I'm not really just a sit on the beach type of vacation. So I like kind of old school Europe history. So probably something along those lines.
I thought you were going to say golfing in Scotland or something, but
I do golf enough, so it's not.
All right,
Don't
sounds
have to
good.
go to Scotland to do that.
No, but when he said Europe and golf, I was kind of starting to put things together a little bit. All right, your turn, Joe.
Is there a specific time frame of European history that you're most interested in?
God, there's so many years, right? I mean, there's just so much older than the U.S. We have 250 years in the U.S. So I mean, I like the ancient Roman times, I guess, with the history, with all the ruins and things like that. So I enjoy the history aspect as opposed to more recent. How did that history lead to where we are now?
History is one of those things that's so fun. I remember I actually started as an art major, and so a lot of my coursework was art history. And I used to tease that it was story time. Like you just go, and what was so powerful about the art was that was how you told the history. And I agree. History is one of those areas that I could just listen to, and going to really ancient places. I mean, it's just incredible, the feel of being somewhere that was created with a 3 digits of a number, So yeah. I can understand that.
And if you really, see history for what it is, you realize how it led to a lot of the way things are now in the world, or in civilization, and so I'm the history, fanatic a little bit.
Oh, that's fun. So now I know what we're going to talk about the next time you have to be quarantined with me for a weekend of teaching. So
yeah, we have.
I'll go. One last one, Joe. Music in YOR. What's your choice, Shane?
Yeah.
That choice is the nurse's choice.
Oh, there you go.
I let them, I usually do some type of contemporary, but it's not heavy metal. It's not rap. I have a few surgeons that really, like that type of genre, but I usually just make sure it's kind of not too loud, and as long as everybody in a room generally has an idea that they're okay with that genre, then I roll with it.
There you go. All right. Well, Shane, we are so grateful for you breaking away from the routine on a Monday evening to meet with Joe and I and discuss your career. Thank you for all you do for the profession. And I look forward to meeting you in person in Vegas.
Yeah, definitely. I'll make sure I come and see you. But thank you for having me. It's been great and having a great conversation.
Joe, any last words?
No, just mirroring the same. Thank you so much, Shane, for the time that you took today to share with our audience your experiences, and especially as it pertains to things like fellowships and the direction of leadership. We appreciate so much your time.
Yeah, you could keep up the good work you guys are doing. Thank you.
Thanks, Shane. And to all of our listeners out there, if you're listening on Apple or Spotify, please give us a 5-star rating, or better yet, leave a comment or two. And if you're watching on YouTube, by all means, become a subscriber. Joe and I will continue to bring leaders in the podiatric profession, whether they're students, residents, fellows, future leaders in that case, I guess, but leaders like Dr. Hollawell. Thank you again. And we're going to send you a Dean's Chat mug.
Love it.
To start your day the Dean's Chat way, Shane.
Thanks, guys. I really appreciate it.
All right. Cheers, everybody. See you next week. Bye-bye now.
Take care. Bye-bye.
Bye-bye.